My name is Tony, and today we'll be talking about adhesive capsulitis, or frozen shoulder. This is a condition where the anterior joint capsule of the glenohumeral joint becomes inflamed, causing pain in the shoulder area and decreasing range of motion in the injured shoulder. The anatomy of this injury is the humerus, acromion, coracoid process, clavicle, and anterior joint capsule. It is unclear as to why adhesive capsulitis is caused, but there are things that will increase your risk. There are three stages. Stage 1, freezing. Most pain lasts 6 to 9 weeks. Stage 2, frozen. Pain may be gone, stiff shoulder. Stage 3, thawing. Motion begins to improve, and it can last anywhere from 6 months to 2 years for complete rehabilitation. The mechanism of injury is unclear, but having past injuries to the shoulder increases your risk of getting frozen shoulder. The signs and symptoms of this is pain that is dull or aching, pain around the glenohumeral joint, it's hard for you to lift your arm, or there's more pain early on to your injury. The special test for this is the shoulder shrug sign, where you lift the arm 90 degrees without elevating the scapula or the shoulder girdle. The other ways to test for this are just your standard range of motion tests. Some predisposing factors are stroke, diabetes, shoulder injury, Parkinson's, avascular necrosis, gender, because it is more prevalent in women. Some differential diagnosis of this is bicipital tendonitis, rotator cuff tendonitis, or subacromial bursitis. Ways that you can treat this are going the physical therapy, just doing at-home range of motion exercises, or getting corticosteroids. There are also some surgical ways, but it's very rare, where you could have actual surgery where they cut you open, or you can have anesthesia, and then the doctors will move your arm into motions that it could not reach before and break up the tissue. You would refer this to a doctor or a physical therapist. You don't want to immobilize it because that would only increase the freezing of the shoulder. There's no true reason as to why this occurs, so there's no true way for us to prevent it. There's not a mulligan technique for adhesive capsulitis. These are my references, and this is my PCOT.